The MAHA movement is stronger than ever. This year, the Trump administration focused on promoting physical fitness, restoring public trust in vaccines, and banning forever chemicals in our water. And more importantly, MAHA backers refused to stop pushing for healthier food, even after an Obama-appointed judge tried to get in the way. In a ruling, Judge Irene Berger issued a 30-page preliminary injunction that temporarily halts West Virginia's proposed ban on foods containing certain artificial coloring dyes. The judge claims the law is, quote, unconstitutionally vague because it fails to provide sufficient notice and invites arbitrary enforcement. It goes on from there, but let's bring in the good doctor, Dr. Oz, to help unpack all this. Doc, I got three things I want to talk to you about, but this crazy judge thinks she knows better than you, knows better than the executive branch, and there hasn't been sufficient notice? We've been living under this for decades. What do you mean there hasn't been enough notice?
Jason, she's swallowed the Kool-Aid from the liberal left, arguing that we should not get involved in issues that protect our children. And the one thing about the MAHA movement is it tends to be bipartisan. There are lots of folks on the left who actually think we should start moving forward on cleaning up the food supply, making it easier to be healthy in America. And so although the judge has created a paperwork obstacle to Governor Morrisey and the West Virginia population benefiting from his executive decision and from his legislative support, I think over time, every single state's going to wake up to the reality that we don't want our kids sick. And my job, as you know, is to help pay the bills. At Medicare and Medicaid, we spend about $1.8 trillion to keep Americans healthy. But if you're getting folks sick with the food you're giving them and misleading them about a slew of other issues, then we're not going to be able to catch this problem from behind. It's one of the reasons that our life expectancy continues to fall despite investing twice as much as any other country on the planet on health care. We can do better, and it starts with taking care of the battle for health in our homes, our living rooms, kitchens, bedrooms. That's where we begin and win the battle.
Well, Dr. Oz, I'm so glad you're there because you're heading up the Centers for Medicare and Medicaid Services. 50 states will receive an average of $200 million in rural communities across the country. Tell us more about this historic investment about modernizing care, particularly in rural hospitals.
Jason, this is the single biggest investment in rural health care in our nation's history. It was a visionary move by the president and by Congress to allocate $50 billion, which, to put it in perspective, is 50% more money than these areas of the country get from Medicaid right now. There's 60 million people at least who live in rural America. They're all going to benefit. Right now, your zip code does predict your life expectancy because folks can't get access to care. They don't get high quality services. The $50 billion was deliberately given in a very rapid fashion to each of the states in a way that forces the governors to take charge, to make the difficult choices to right-size the rural health care system, use modern technology to streamline care so you can use AI or telehealth if it's appropriate. We can get the right number of doctors and nurses into these areas. We can begin to get groups to work together who historically would not collaborate to help our fellow Americans. And the best news, Jason, is what we learn through these innovative approaches in rural America is going to benefit urban America. So if you live in the inner city, it's still going to help you because the things we learn about making the care of the average American better helps all Americans.
Well, I got to tell you, this is the last topic I get with you here, but tell us about the dietary guidelines in the food pyramid, because I got to tell you, I feel like the government lied to me my whole life. At the base of that pyramid, it said carbohydrates, and they told me I was supposed to eat all these grains and cereals, and I would have 2 bowls of Life cereal before I went to bed. Ends up that probably wasn't very good for me, but I did it for, 50 years. So what in the world? They lied to me. How are we going to make it right?
They did lie to you, Jason. And one of the reasons Secretary Kennedy is so passionate about this is because the food pyramid originally was an advertising vehicle by cereal companies. The food agenda for this year, and you see it up there, the MAHA movement, again, make America healthy again by actually starting with the food we put in our body, making sure we exercise that body. We get to sleep more effectively for doing those things, by the way. Deal holistically with the issues we face in America. Moms in this country are crying for help. It is so much harder for them to raise healthy healthy children than it was for their parents to raise them, and they know it. And they spoke loudly in 2024. They're going to speak in the midterms, and Secretary Kennedy will not be daunted, and he's got the president's full support to make sure he pushes his agenda. So you're going to see dietary guidelines coming up, more clear definition of what ultra-processed foods mean, and without question, we have issues even in the rural health transformation bill we talked about earlier, that $50 billion fund that we put out. In there, we're asking states to commit to waivers on the food we give to folks on SNAP to make sure it's healthy.
Yeah. I was eating Life before I went to bed. It ends up that wasn't helping my life. I'm just saying, Life cereal, it just wasn't helping me. But Dr. Oz, you know better than we do. Do appreciate it. Thanks for joining us. Appreciate it.
Click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis. You won't get it anywhere else.